Yeah, mistletoe is the same type of mistletoe you hear about in Christmas time, and it actually has a long track record of use, especially in Europe. You know, way back to, you hear about the Druids using mistletoe as a plant that had a lot of properties for them. There's a famous doctor, Dr. Rudolf Steiner, that used mistletoe to help restore certain body types of, restore the body balance to make it work better. And as a consequence, because of this history, it's also been applied a lot in cancer in Europe. Mistletoe is the #1 used form of alternative, complementary, integrative medicine. #1. It's ahead of vitamins, minerals, diet therapies. It's ahead of all of that stuff. And in turn, because of this attention, there's a lot of research on the use of mistletoe in cancer care. A lot of it. In fact, most of the research that's been done with it is in combination with surgery, radiation, and chemotherapy throughout the decades.
Yeah, has it really caught on in the United States and Canada and North America in general, has it?
No, North America in general for these type of things have been slow. There is some research being done as we speak in various medical centers in the United States. But you know who actually put mistletoe on the map more recently is that well-known actress Suzanne Summers. You know, she had breast cancer. She was kind of creating her own type of treatment program a little bit. I don't think she didn't want to do chemotherapy, and decided to use mistletoe as part of her treatment tool for her breast cancer. So in turn, that sparked a lot of attention again, and I think it deserves some merit because it's nothing new. It's not a fad. It's been around a long time. It's been used for over 70, 80 years. And I think as more research and more attention catches on, you'll be seeing a lot more mainstreaming of it, personally.
Can you give us some detail on how mistletoe works and how it fights cancer or helps the body fight cancer?
Well, it works on various ways. One of the ways is that it helps to restore the body. Like when you look at the research looking at mistletoe, for some reason, it helps to improve appetite, help with pain control, it helps with energy, and they don't know why it does that. So there's something about it, in these ingredients. We do know that it has immune stimulatory properties. Like if you measure cytokines, you can see them actually go up with using mistletoe. There's components in mistletoe that are actually cytotoxic, meaning it actually can kill cancer cells or it can put them to sleep. And so it has all these type of properties because mistletoe, there's not one ingredient in there. There's a combination of plants, lectins that are in there. That's what they're called. There's a whole bunch of them that are in these, in mistletoe.
And is there only one variation of mistletoe you use? Because I heard there are, 2 or 3 of variations available. And can you talk a little more about?
Yeah, the mistletoe. I guess I forgot to mention is that what it is. It's a parasitic plant, and so there's different types of mistletoe grown on different types of trees that may have different types of properties, and so through the research they've shown that certain types grown on certain trees do better for some types of cancers than others. And then there's also different companies that make mistletoe. There's about 3 popular ones. One's called Iscador. That's the most researched. There's one called Helixor, and there's also one called Isorel, and they're all made from Europe. And so different ones have different type of properties. They're made a bit differently, but in general, the use of them, the concept are quite similar, and they're all trying similar things.
What is a mistletoe treatment like? Is it an injection? Is it an oral supplement? What is it like?
The more standard and more researched way of using mistletoe is given by injection. And what you do is you're actually giving yourself injections underneath the skin every second day of mistletoe. Every second, every third day. And it's an ongoing treatment, depending on the type of case, the severity, etc. So the use of mistletoe is something that people could be on for years.
So is the injection done on the locality of the cancer, or is it can it be done anywhere?
You can do it that way, but it can also be given just generally. So you can give it, say, how a diabetic injects himself with insulin in the abdomen or in the leg. That's it. The site necessarily is not key, but if you do it closer to a site, it can work better.
And so I guess final question would be, can patients take mistletoe with chemo and radiation as some of the research has suggested?
Absolutely. Like again, the primarily the data that's out there on the use of mistletoe in cancer care has always been done along with chemotherapy, radiation, and surgery. So I don't think it's an area where there's too much concern. And I think while again there's not a lot of data on the newer types of chemos that are out there, I think generally speaking it's quite safe that way.